Kia ora tātou. Welcome to the final presentation overview, lunchtime series of the updated Ngā Paerewa Health and Disability Services Standard. And most of you has likely attended all sessions or many of the other sessions. So as you know, we will first start with our karakia to welcome you all to this particular space and presentation. You're welcome to join me. Whaia, whaia, whaia. Ngā uaratanga o te manatu haora. Ko te manakitanga, ko te kaitiakitanga, ko te whakapono, ko te kokari ngā tahi, kia tai atu tātou, ki pai tata, ki pai tawhiti, ki pai ora, kia tuturu, ka whakamoa, kia tina, homie huie, so welcome everyone again. We will start with our housekeeping. We are recording this session, and in fact we have them available online already, the first three of this series. You can now visit watch on YouTube, share with your peers. So these will continue to be made available as soon as possible with a transcript and then uploaded. We will be answering all questions at the end of the session, and we will be publishing the slides on our website, and that's not too far away now. And I'm sure many of you have seen this video now. Ashley, Director General Bloomfield, has introduced Ngā Paerewa Health and Disability Services Standard, and this video does provide a good overview for those of you, if you'd like to share this, of what the intent and what went into this review. We recommend that you watch that, but we will not do it in this session. And just in case we have anyone new joining us, the 2021 standard, it was published on the 30th of June. Ministry, we have paid for the best access that we can, the most complete access that we can. So you can now, this allows you to download and print a copy of this 2021 standard for free. And there's a link available on the Ministry of Health website, and then this is the direct link as well. What we will be covering today, I'm going to provide some quick context in terms of the language that we're using, which comes from the mapping that we have done. I'm going to outline some of the major changes, just because that will also inform the presentation later on. Then Christine will go into our the deep dive in terms of what is different compared to the 2008 standard, and then we'll take questions. And actually, when I just said Christine, I realized I forgot to do introductions. Christine, would you please introduce yourself?
So I'm Christine Masters, Principal Advisor of HealthCert, and Jade, for those that don't know Jade, they can also introduce yourself, so apologies.
Apologies, you'd think by the sixth one I'd have this down pat. Kia ora, ko Jade Tako Ingwa, and I am Principal Advisor for Quality Assurance and Safety, and I was Project Manager for this review. So some good knowledge between us. Yeah, sorry about that. And then, as mentioned earlier, we'll take questions at the end. So the mapping analysis summary, this is something, HealthCert, we have completed the official mapping of the 2008 standard and the other standards as well against the 2021 standard. And we have categorized this mapping into 3 elements. This will be available on the website, again, not too far away. It's just through final sign out here within the ministry, nearly there, final edit. But the language that we're going to be using is the same that's in that mapping document. So we're going to be talking about criteria that directly map, which means the criteria is the same or that it has the same intent. So these are not new, but the wording may differ slightly. We have partially new and partially mapped criteria. So this means that the 2021 criteria is similar to what is currently there, or perhaps it is the same but has a new element. And the wording, again, will likely differ. New or unmapped criteria is criteria that does not map to anything currently, so it is new, and this area is what we will be focusing on in today's presentation. One of the big changes of the 2021 standard is this updated criteria application framework. So as we're talking today, it's important to know that not all criteria apply to all services. At the front end of the 2021 standard is this criteria application framework, and it outlines which criteria apply to which service type. And this is also available in the sector guidance document. The sector guidance is also now available on the Ministry of Health's website. So if you have the current standard, or if you're familiar with it, you'll know that the guidance is on one side and the criteria on the other. We have taken out the guidance, and this is now overseen by the Ministry of Health. And what this allows is for us to update it more regularly to reflect changing models of care, and also any action plans or strategies that are going on. And we also look to hear from you, the sector, on what needs to change. So we have a process set up for that, and if you would like to be involved or updated and informed on that going forward, just email certification@health.govt.nz, which is the same email you used to join us today. This is a live document. And the other useful thing about this setup is that you can just expand the sector guidance that you would like to look at, and just press print, and it should adjust automatically to your printer paper size. And now I'll hand it over to Christine to talk about the implementation transition plan.
Thanks for that, Dave. So we'll just touch on this lightly for those that have been attending these sessions regularly, and it really is just to outline that that we're progressing each of these elements as the weeks are going by. So the biggest message is really around the implementation transition plan is that it's a staged and transparent, non-punitive approach. So we want to ensure that providers have time to come up to speed with the new and partially new elements of the 2021 standards. So for those new unmapped criteria and the partially mapped criteria, we're going to have implemented some grace periods before full implementation is required. So what that means is we're going to enable the sector to have time to implement and progress towards meeting those criteria. So for the partially new, we'll have a shorter grace period of around 6 to 12 months to implement before you will receive a partially attained award in terms of audit. For the new criteria, we're looking at a 12 to 18 month grace period before you will receive a partially attained rating at audit. We would, however, expect when you are having an audit through the grace periods that you are actioning or progressing or developing plans that can be evidence that demonstrate that you're working towards progressing and reaching full attainment for those criteria. The grace periods will also be informed by the audit pilot, which we're going to be implementing between August and November. And we're just working through the details of the audit pilot, and we'll be able to share that with you hopefully in the next week or so in terms of the planning and the direction around the methodology. So effectively what we're wanting to do is to test in the sector certain service types, including ARC and residential disability, including mental health and AOD services, and also in the private hospital space, so private hospitals, surgical hospitals, hospices, maternity units, to test how the 2021 version of the standard will be transitioned smoothly from the 2008 to ensure that the cycles and the audit outcomes are fair and reasonable in that transition process. We're going to be working with DAAs in that process to enable that, and we're really interested in providers who are willing to participate in that as a learning opportunity. So watch this space. We're also developing resources. So as Jade spoke about before, the sector guidance, there's lots of links and lots of information within the sector guidance around information to read and consider that might be appropriate to your service types for how you might demonstrate or begin to demonstrate evidence to meeting the criteria. On top of that, we're developing some online e-learning modules to support providers for the updated Te Tiriti content of the standard. So we have re-established the Health Cert Bulletin. We can expect another one to come out towards the end of September, beginning of October. And we're aligning the DAA handbook with Ngā Paerewa 2021 standards. So that hasn't been released or updated since 2019. So we're looking forward to that. We also really want to obtain feedback from the sector. So we really want to understand what you need in terms of helping you to transition to implement the Ngā Paerewa standards. So we're going to be sending out stakeholder surveys, and the next or the first opportunity is going to be in the next week or so. We're really almost at the point of releasing that, and then we're going to repeat that every 2 to 3 months, just as a pulse check, really, just to see how we're progressing and what it is that you need to know to help you. We're also interested in what events or conferences or forums that you might have nationally or regionally for us to present at. Now, we're not going to be able to present to all, but we're really interested in what's out there that might support the implementation moving forward. So section 6, so what I'm going to work through here is, in fact, the section 6, which is the last section of the Ngā Paerewa standard. So this is the seclusion and restraint section. So here we've got 6.1, which is a process of restraint, and we've got within section 6 actually 4 subsections. And they used to be called standards, and that's new language for us in Ngā Paerewa. So we've got one standard, and here we've got sections. We've got 6 sections, and within each section we've got subsections. And for the seclusion and restraint section, we've got 4 subsections. Within that, we've got 24 criteria, 2 of which have been mapped as partially new criteria. So that means there's an element of familiarity and something that's been included that's new. And we've got 6 not mapped or new criteria. So we've got an outcome statement for each section. So this outcome statement is about services aiming for a restraint and seclusion-free environment in which people's dignity and mana are maintained. So as I said before, the 6 subsections include a process of restraint, safe restraint, quality review of restraint, and seclusion. And you can see beside each of those subsections, there's a number of criteria varying numbers. So what I'm going to do is work through each of those subsections, and we're going to pull out of those subsections the partially new and new criteria, and then we're going to delve a little bit deeper into those. You'll see that the first 4 fit that criteria here. So 6.1.1 and 6.1.3, the criteria on the left, are both partially new. So there will be some element of familiarity around restraint here, but there will also be a new focus or a new element within that. 6.1.2 and 6.1.4 are both new components, new criteria within the standard. On the right-hand side, you can see the applicability to the service types. So here is where at the front of the Ngā Paerewa standard, you'll find tables which show for each section what service types are applicable to each criteria. And so we've got that specified on the right there. And I'm going to move to focus on the partially new and new criteria. So as I said before, 6.1.1 is a partially new criteria. This is about a process of restraint, and here we've got governance bodies demonstrating commitment towards eliminating restraint. So with that, we know that we've had demonstration for commitment in the reduction of restraint practices for a long time, but now we've got within and written and documented in the criterion in the standard that we're actually moving towards elimination of restraint. So it's a more defined criteria in terms of the intent. So you'll see in the middle column that there's no general guidance for all providers, as there are in some other sections, but there is service-specific guidance in the website, and that's available for the listed services there, and that information is specific for those service types and scope. And again, it's not applicable to all services. 6.1.2 is new. This is about service providers demonstrating commitment to ensuring the voice of people with lived experience, Māori and whānau, is evident in the restraint oversight groups. So we're wanting oversight groups whereby there's the ability for those groups to demonstrate that they have commitment for the voice of lived experience, Māori and whānau within that. Again, there's no general guidance for all providers, but there is service-specific guidance there for residential disability, including mental health and AOD, and for DHB inpatient and private hospitals. And you'll see that those are the only applicable services for that particular criteria. .1.3 is the partially new criteria again, and here we've got familiarity around commitment to restraint minimisation, as was in the 2008 version of the standard, but this is about ensuring that there's an executive leader who's responsible for ensuring that this commitment to restraint minimisation is now also including elimination in the implementation, and that is maintained. So the focus here, the new direction, is not just about restraint minimisation, but it's actually about how can we demonstrate and how are we moving towards elimination, and how is that being maintained. So again, there's no general guidance for all providers, but there is service type specific guidance on the website for the listed service types. And again, it's on the right, not applicable to all services, but you can see those where these criteria are applicable to. And when we come to do the service-specific section workshops, such as ARC, we'll be going into what that service guidance, sector guidance is for those service-specific sections. 6.1.4 is also a new criteria. So this one is about ensuring that executive leaders report restraint at defined intervals and aggregate restraint data, including the type and frequency of restraint to governance bodies. Now this happens in most services, but it's not been required in all services, including those in the applicability list. So it's been extended to include more service types. Also, a new element is that data analysis shall support the implementation of an agreed strategy to ensure that the health and safety of people and healthcare and support workers. So that's an added element to ensure safety for our workers in this environment, which is challenging at times. So again, there's no general guidance for all providers, but again, there is sector guidance specific to those service types as listed. .2. This is a subsection about safe restraint, and there's 8 criteria in this section. So you can see this first slide, 6.2.1 to 6.2.4, is actually familiar and is reflected and mapped in the 2008 version of the standard. It may not be in the same order or the same wording, but certainly the intent is there. What the Ngā Paerewa standard has also done is to reduce duplication, and it has themed a number of elements that were in the 2008 standard that were separated into different criteria in the Ngā Paerewa, sometimes they've been put together into one criteria. And again, here we've got the applicability. It's not applicable to all service types, but there's a list there that demonstrates which the safe restraint criteria from 1 to 4 here in the 6.2 subsection refers to. 6.2.5 through to 6.2.8 was within this slide, we've got one new criteria, 6.2.6, and I'll go into that in a moment. We've got 6.2.5 through to 6.2.7 with applicability to the service types that are in the right-hand column. And with 6.2.8 down the bottom there, we've got applicability to less services. So this particular criterion is not applicable to ARC, fertility, home community, birthing and abortion services. So I'm going to go through the detail of 6.2.6 in a moment. So as I said, 6.2.6 is a new criterion. This is about service providers considering who the most appropriate member of staff is to debrief the person who has been restrained. So again, there's no general guidance for all providers, but there are service-specific information there for those service types. Six 6.3 is about quality review of restraint. 6.3.1 is the only criterion in this subsection, and you can see there's a lot of criteria being added to this. So there's a lot of elements that will be audited against, or that providers will need to demonstrate if it's applicable to your service. And you can see on the right-hand column the services that this particular criterion and subsection is relevant for. And you can see that all those elements link back to the 2008 version of the standard in some form or another. Six 6.4 is about seclusion. So this is the last subsection for this section. And you can see that there, again, there's 9 criterion for this subsection. And the first page here, this slide is from 6.4.1 through the criterion to 6.4.6. Seclusion is only applicable to residential disability ID services under the Act, and also public hospitals, mental health units only that have seclusion units. And so when we come to those specific targeted sessions, then we will talk in more depth around this. But for 6, I'm just going to move to the next slide. So you can see here 6.4.1 and 6.4.2 are new elements for this subsection. And we've got 6.4.9, which is also a new element. I'm just briefly going to just touch on those new elements, but we will be going into them in more depth when we do this sector specific guidance. So 6.4.1, what is new here? It's about service providers ensuring that they work towards a seclusion-free environment. So it's really specifying what the intent now of is and the direction for seclusion. 6.4.2 is about seclusion data being provided to governing bodies on a monthly basis and strategies to support elimination of seclusion that will be agreed and implemented at that governance level. So that's really very specific and clearly states the direction and the expectation moving forward. 6.4.9 is an inclusion of a specific requirement that we've had in the sector for some time, but it's really not been specified specifically. It's been expected, but now it's in the standard, it's in the expectation, and that's around night safety orders being recognised as restrictive practice. So we don't want to see that in practice. I'm going to hand back now to Jade, and we're at the end of the section, and of course it's a smaller section, and so we're going to be able to, depending on your questions, of course, gift you some time back, which is always useful. So I'm going to hand you over to Jade again, just to talk through the implementation timeline, and many of you will also have seen this, and we're continuing to progress things along this. So I'll hand back to Jade. Thanks.
Kia ora anō. So this slide kept the key milestones. So we had standard approve, the standard New Zealand board approval of the standard, which what led into the Minister of Health approving the 2021 standard for use under the Health and Disability Services Safety Act. This was then published on the Ministry of Health website along with the sector guidance on the 30th of June. So now we are full into focusing on implementation and how we can support you, the sector, to be prepared for when the updated requirements come into force on the 28th of February 2022. And we have, under this heading sector engagement, we have quite a few plans to support that. So one of the online workshops being the first series, so that was a general overview by each section within the 2021 standard, and these we ran over lunchtime, so that way hopefully we could increase attendance. And we have, as mentioned, those will all be available online, the recordings as well as the slides themselves. We are then going to focus on piloting the 2021 standard with providers, as Christine has gone into, and that will help us see what needs to change or needs to be put into the DA handbook, as well as this updating the sector guidance if required. We are then going to run targeted sessions and focus on attending conferences. So the targeted sessions will be based on the planned audience, so to speak. So anyone's welcome to attend whichever one they would like. However, there will be one that is directed towards age residential care providers and what's changed for them from their view. There will be one for auditors, how we expect them to audit, some guidance there, and for people in whānau as well, so that way they know what their rights are under the new standard, updated standard. Also accepting attendance to conferences and things like this over that time. As Christine also mentioned, we are sending around a check-in survey to see how the sector is feeling about the updated standard and familiarity with it, and engage familiarity. We'll be running that at points throughout implementation, and we will be running sessions based on the feedback of that survey, saying, oh, we would like some more guidance around this particular section or criteria, et cetera. And so we'll develop some focused workshops based on those. And that will all be in preparation for that 28th of February date for compliance next year. And now we're at questions, just like that. Perfect.